Around the world, 3 million people die from cardiac arrest every year. Survival rates vary from as low as 1% in some places to 25% in others. That means, in a city of 1 million people, it's the difference between only 5 lives saved and 125 lives saved. The first 10 minutes can mean the difference between life and death. How can we help save more lives? In the first few minutes, a bystander must call for help. This starts the chain of survival.
The first 4 links in the chain of survival rely on you to help. Being able to recognise the signs of sudden cardiac arrest is the first link, followed by calling emergency services, commencing CPR, and applying defibrillation. Speed is key. For best results, CPR and defibrillation should be commenced within the first few minutes of a sudden cardiac arrest. This is because for every minute lost, the patient's chances of survival drop by 10%. Quick thinking and calling for help, CPR and defibrillation buy time for emergency services to arrive and give the patient their best chance of responding to advanced hospital care.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock.
About CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing, because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S, shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally.
person who needs CPR has no response, has no pulse, and is not breathing. If a person meets these criteria, they need CPR. High-quality CPR is composed of two basic actions: compressions, ventilation, and airway. To do proper compressions on an adult, a rescuer must place his hands on the lower half of the breastbone, compress at a rate of 100 to 120 beats per minute, compress in groups of 30 compressions, and compress 2 to 2.4 inches with full recoil. To do proper ventilation and airway management, you must have a tight seal with the mask, tilt the head back, and blow into the one-way valve enough to see the chest rise, but not overventilate. Make sure you always use a barrier device to ensure that you and the victim remain safe.
Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives.
Once you turn on an AED, the machine will begin to speak to you. Follow the voice prompts. Once the pads have been placed, the AED will instruct you to stand clear and to not touch the patient while it does an ECG of the heart. The AED is designed to determine if the heart is in a normal rhythm or if it needs to be shocked. In this case, the heart is in ventricular fibrillation, the most common rhythm when someone goes into sudden cardiac arrest. Notice how the heart is not beating effectively. It has electrical activity, but it is uncoordinated. The heart looks like it is shaking like a bowl of jelly. When in this rhythm, you can see the heart is not effectively pumping any blood out. This rhythm is deadly and has to be stopped. When the AED reads a shockable rhythm, the AED will either instruct you to press the shock button, or some AEDs are automatic and will automatically shock the person. At this point, no one should be touching the patient. The AED will send an electrical current through the heart and back again. The purpose of this shock is to stop the heart completely for a very short period of time from this uncoordinated rhythm and give it time to reset. Notice how the shock stopped all the electrical activity in Steve's heart for a brief period. Seconds after this shock, our own SA node, the pacemaker of our heart, will try to regain control of the heart and tell the rest of the heart when to squeeze. It can take up to 2 minutes for the heart to reorganize itself electrically after a shock, before it will function again and effectively pump blood to the brain. This is why you will be instructed to begin CPR immediately after the shock. Your job is to push hard and fast in the center of the chest in order to manually pump blood to the brain, to keep the brain alive. Your compressions will not interfere with the heart trying to reorganize itself electrically, so do not worry about that. After 2 minutes, the AED will instruct you to stop CPR. It will reanalyze the heart and advise whether another shock is needed. Always listen to the machine and follow the voice prompts.
If a person begins to breathe, roll her to her side into the recovery position until professional help arrives. Take the victim's arm closest to you and place it across her chest under the chin. Extend the other arm above the victim's head. Take the victim's leg closest to you and bend it at the knee to prop it up. Roll the victim away from you. This position will help keep the victim's airway open and will allow fluids to drain from the mouth. Be sure to monitor the victim until help arrives.
Christy. We're going to need to help you breathe, so we're going to put you to sleep, put a breathing tube down your mouth, and put you on a breathing machine, okay? Okay. Brian, I'm going to use a small ET tube, so I need a size 7.0, please. Let's do the airway checklist. Code status.
Full.
Suction ready?
Yes.
Ambu with O2 and oral airway ready?
Yes.
Okay, airway cart with glide scope ready?
Yes.
Monitor ready?
Yes.
Meds confirmed and ready? Positioning. Christy, I'm going to take your pillow away and put some towels behind your head. End tidal CO2 ready?
Yes.
Plan A, I'm going to use the glide scope. Plan B, I'm going to use direct laryngoscopy.
Beth, I brought the emergency C-section tray.
Okay, can you make sure the warmer's next door and Dr. Wagner's on the way?
Yep.
It looks like their sats are dropping and the heart rate's slowing down.
I don't feel a pulse.
Okay, call a code and start CPR, please.
Steph, will you perform left uterine displacement? I'll call the OB charge and NICU team. This is Beth in the ICU. We've called a code on Christy Nelson, room 2022. Send the NICU team now.
Okay. And the epinephrine was given?
Yes.
Do we have a good pulse with compressions?
Yes, we do.
I'm gonna go next door and let them know that we're here. NICU's here, we're setting up next door.
Thank you.
Hey Lisa, what can I do to help?
Run the code, please.
Okay.
2 minutes right now.
Okay, let's stop for a rhythm check.
Milligram epi given. 1 milligram epi given.
What's the end tidal CO2?
The end-tidal CO2 is 18.
Should we apply the Lucas?
No, let's continue resuscitation with the backboard. We're anticipating an emergency C-section at 4 minutes.
Where are we in CPR time?
Coming up on 3 minutes.
Okay, we need to prepare for cesarean section. Let's move now.
We're at 4 minutes.
We need to deliver this baby. Skin. Uterus. Placenta. Pit. What we're going to do is pack this uterus, get her resuscitated, and take her to the main OR.
At the next pulse check, let's apply the Lucas.
a response, gently tap or flick the sole of the baby's foot. Never shake a baby. If there is no response, shout for help. Place the baby on a firm surface. Open the baby's airway by placing one hand on their forehead and gently tilt the head back. Place the tip of your forefinger of your other hand on the infant's chin and lift it. Do not push on the soft tissue under the chin, since this may block the airway. Check for breathing. Look, listen and feel for signs of breathing for 10 seconds. Remove any visible obstructions from the mouth. Give 5 initial rescue breaths. Tilt the baby's head back again and place your lips over the baby's mouth and nose, ensuring a good seal. Blow into the baby's mouth and nose for a second. Watch for their chest rising and falling. Begin chest compressions. Place the tips of your fore and middle fingers in the center of the baby's chest, keeping your fingers straight. Press down vertically about 1/3 of the depth of their chest. When releasing the pressure, do not remove your fingers from the baby's chest. Do 30 compressions at a rate of 100 to 120 per minute. If you are on your own, perform CPR for 1 minute before calling 999 or 112. Put your mobile on loudspeaker. Give another 2 rescue breaths and continue the cycle of 30 compressions and 2 rescue breaths until an ambulance arrives, the baby shows signs of becoming responsive, or you are too exhausted to continue.
What is choking? Choking means something such as food or an object has gotten stuck in the airway, preventing air from getting into the baby's lungs. Choking can be mild or severe.
Choking is a life-threatening situation that requires immediate action. Every second matters. If someone is effectively coughing, they are not choking. Encourage them to keep coughing and stay with them. If they stop coughing or you hear a high-pitched wheeze, this is the sign they are choking, that their airway is blocked and they need your help to dislodge the object. If their airway is not cleared, they could become unresponsive within a minute. Ask if they are choking and if you can help them.
Are you choking? Can I help you?
Immediately instruct them to lean forward. Support them and administer up to 5 back blows in the center of the back between the shoulder blades. You need to generate enough force to produce an artificial cough, which will hopefully dislodge the object that is stuck. If the object does not come out after 5 back blows, begin administering 5 abdominal thrusts. Place your foot between their feet. Locate their hips. Make a flat fist and place just above their belly button and below their rib cage. Begin to pull in and up with enough force to produce an artificial cough. Stop if you see an object come out or you begin to hear them coughing or speaking again.
Are you okay?
Encourage them to sit down and relax.
In an event that a child is choking, you need to act swiftly to avoid endanger the child. First step to try in such situations is asking the child to cough. Coughing is an effective way to push the object out. If the object is not clear, stand beside the child and lean them forward. Using the heel of your hand, make 5 quick blows at the child's back between shoulder blades. The back blow should be upward toward the victim's mouth. The blow creates strong vibration and pressure in the airway which help to dislodge the object. If the object still does not come out, perform the Heimlich maneuver. Standing behind the child, put your arms around their torso. Clench one hand into a fist and place it just above child's belly button, below the lower ribs, thumb faces stomach. Cup the other hand firmly over your fist. Using both hands, thrust your fist toward the child diaphragm in your direction and upward. Repeat the maneuver until the object is clear. In case the child has passed out or cannot stand, perform the following steps. Lay the victim on their back. Sit next to their hip and face them. Put one of your hand on top of the other and place the base of your palm between their belly button and lower ribs. Push the abdomen towards the diaphragm, pushing in and up. Repeat several times until the object is clear. Note that in the case the child is unconscious, check their mouth every 5 pushes for object. Perform CPR only after the object is clear. In an event that an infant is choking, what needs to be done? Stay calm and lay them face down on your arm. Ensure head is lower and supported by your hands in this position. Using the heel of your hand, make 5 quick blows at the infant's back between shoulder blades. The back blow creates strong vibration and pressure in the airway which help to dislodge the object. If the object is still stuck, lay the infant on their back. Use 2 fingers to make 5 quick thrusts on the infant's breastbone. This chest thrust will squeeze the air out of the infant's lung to dislodge the object. Repeat the above multiple times if needed until the blockage is clear. Call emergency number immediately to have professional medical support.